Welcome to the Daily Dose of Derm podcast, your go-to podcast for all things dermatology. I'm Dr. Mohiba Tareen, a board-certified dermatologist and the founder of Tareen Dermatology. Join us as we dive into the fascinating world of skincare, beauty, dermatologic treatment, and how to enter the world of derm. Whether you're a skincare enthusiast or an aspiring medical professional, this podcast is your daily dose of knowledge and inspiration. Get ready to uncover the secrets to healthy skin and discover how to make a meaningful impact in the field.
Hello, everyone. My name is Shia Badam. Welcome back to the Daily Dose of Derm. I am honored to be sitting here with my good friend and not only coworker, Jackson Lee.
Hey there.
Thank you
hey.
so much for being here, man.
Oh, of course.
Thanks
It's
for talking.
more than a pleasure. Yeah.
Well, we've been through the trials and tribulations, not only
Have
in
we
life,
ever? Yeah.
but not only this job in general.
It's a great point, yeah.
It's been great. So just introduce yourself. Where are you from? And talk about your life background. And
Yeah.
just
Sounds good.
The
Yeah.
people want to know.
Yeah, good point. Yeah, true. So, I'm Jackson. I just turned 24 years old back just a few days ago. So
Nice.
I'm from Apple Valley, Minnesota. So I'm pretty local to the clinic. Grew up in Apple Valley, went to Eastview High School. Shout out Eastview, go Lightning.
Nice.
And then I did my undergraduate degree at St. Olaf College. And so did 4 years there. I was a biology major. No minors, just straight up biology major. I'm on the pre-medical school track. And so that was sort of my focus in school. And now joining the Tareen Dermatology team, that's sort of my goal, to do something in my gap year period to prepare me well for med school.
Absolutely.
So
How long have we been here now? We came in together.
Oh man, so we came in together, and now at this point it's been about a year and a half.
Yeah.
So it'll be, time flies. I mean,
Absolutely.
in a way it feels like an eternity ago, and in a way it feels like last week.
Yeah,
So,
100%. 100%.
Yeah.
So kind of talk about what your role is being on Dr. Tareen's team currently. What is your kind of official role now?
Yeah, for sure. So, I kind of fill two different roles depending on the type of patients we see in a day. First of all, I'm just a general medical assistant. And so Dr. Tareen tends to see a lot of surgery appointments and then also a lot of, full body mole skin checks. And so on those routine days where we're seeing the skin checks, I'm a medical assistant, which is sort of like a nurse for anyone not affiliated or familiar with the medical assistant title. I'm the one bringing the patients back, talking to them, numbing them, doing all the kind of grunt work before Dr. Tareen comes in. So, but then on the surgery days, I'm one of the head surgical assistants Dr. Tareen has. And so I'm right by her hip on surgery day, which has been super, super fun. She sees about 80 patients a day. And so we go into a lot of rooms together. I'll be stretching the skin, making sure the visit notes are all tidied up in the right way. And it's really fun to kind of see a lot of different sides, different types of appointments with Dr. Tareen.
Right.
So,
No, absolutely.
yeah.
I mean, as medical assistants, we see a good plethora of stuff.
Yeah, a
whether
lot of
it's
variety.
Very, gnarly skin cancers or, anything such as that. But what are some of your most memorable, whether it's experiences, stories, just as an overall gap year, program associated?
Well, one of the most all-encompassing stories I have that I feel like is fun to share is, and you remember this too, of course, but it was last winter, maybe 2 winters ago. So we were pretty early on, but it was a big snowstorm. It was like a snow-nami. It was huge. And so we go down to our Faribault clinic every so often to do surgeries. And there was 1 week where it was a Thursday night and the forecast was terrible. It was terrible. It was supposed to be like 8 inches of snow just overnight. And so the Tareens were generous enough to cover all bases and make sure everyone could make it down to our Faribault location. They booked all of the medical assistants a hotel room at the Grand Stay Hotel next to the Tareen Dermatology Clinic in Faribault. And so instead of making the drive at 6:30, trucking through the snow, we were all holed up in the hotel together. And of course, no one was traveling, so I think we basically had the hotel to ourselves.
They definitely plugged. Yeah,
they definitely,
it was great.
The continental breakfast was only us.
Incredible.
Yeah, it was. I mean, it was great.
Continental
It was great.
breakfast. You can't forget the continental breakfast.
It also goes to show with Tareen, medicine sleeps for no one, right? And so the next day we were open, and people have to take care of their skin cancers. They're not just gonna shove that to the side and expect that everybody will just sleep in. So,
right.
We saw all those patients that day, and they were really grateful we were open, and no one got into a car accident.
Thank
So,
goodness, yeah.
but also, as well as being something that was convenient for patients, it was also like a bonding experience. It was fun to it was almost like summer camp, like
an
type vibe
official
and like
work
one
trip, but it was just with a bunch of buddies.
Like a field trip. It was
so
great.
much fun.
It was super great. So
No,
I love that story.
That was incredible. That's top 3 at least.
Yeah, for sure.
But going back to kind of just the role as us as medical assistants, I feel like we've always mentioned and we were actually trained to we're essentially the bridge between the patient and provider.
Yes.
What is that kind of, not only kind of the procedural stuff like numbing and all that, but how do you kind of articulate that and kind of think about when you do see patients?
No, I think a bridge is sort of a good metaphor for it. We are obviously on the medical team, but at this point we don't have the degrees that doctors do.
Right.
And so like Dr. Treen or any PA that you see will come in and do the stuff that only the professionals can do. They'll do the removal, but because they see so many patients a day, it's sort of left up to us to be the communicator or almost like a translator in a way. Sometimes they say medicine is like a second language, and we have now become fluent.
Right.
And so we gotta tell all the bankers and teachers and old 85-year-olds how medicine goes, because a lot of the biopsies we do and the skin cancers we talk about are pretty complex stuff. It's not it's not just like a cut or a scrape that you can pretty easily describe. Like these are really complex things that our pathologists look at and that our doctors diagnose. And so we both, I think, have had to learn to take all of the complex medical stuff and sort of put it into like an easily digestible few sentences
100%.
So that patients can kind of get on the same page with we're at. Right. And that takes a lot of time and work. That was one of the things I really had to get better at as I went on, was just learning how best to communicate with people, because sort of no matter what line of work you're in, communication is paramount. It's key. So you got to be good at it.
No, that's fantastic. That's awesome. So what were some of the things you struggled with? I mean, we both struggled in the beginning. With any job, you're obviously going to struggle. There's a huge learning curve.
Yeah.
With this job, there was definitely a pretty big learning curve.
Huge learning curve. I think something that I struggled with was knowing, obviously everyone's going to make mistakes. People are going to forget certain materials on the surgery trays that we make. I think there's just a lot going into a medical appointment that needs to be documented. And so one of the hardest things was learning how to properly chart a medical visit, because as simple as you think a visit might be, all of the details of every appointment, every word that gets said in the room needs to be documented, and that's our job. And so that was one thing that was hard to learn, how to properly write in medical language and make sure everything's documented. Another thing was also, I think it's a rewarding thing, but also kind of a tough thing sometimes, is there's a real human element to this job. And if you make a mistake, the person who's suffering because of it is a patient or one of your coworkers. Right. And so, the consequences of your actions are something that's pretty heavy when you're dealing with anything in the medical field. And so I think there is also just a lot of pressure to not make a mistake, or if you do have it, not make a huge impact. And I think that pressure was something I kind of struggled with too. But on the flip side, it also makes this job one of the most rewarding workplaces out there, because all of your good work gets seen and experienced by real people and real patients.
100%. Yeah. Very well said. And that's really interesting, and kind of segueing into kind of some of the more satisfying aspects of this job. For me personally, one of my most favorite things about this is just getting to know people, right? Like bringing a random patient back you've probably never met before, maybe we'll never see again, but I love just getting to hear people's stories, small talk, as obviously we're moving through the medical visit, but sometimes this is not a comfortable type of doctor. No one likes going to doctor's appointments. No one likes going to your dentist. So being able to make it the most, very satisfying, comfortable experience for patients is something I always look kind of forward to. So what is something that, you kind of think about, or something that really brings you an overall fulfillment, really, with this type of job?
Yes. I hear you. Yeah. I mean, I'm very similar to you. I'm like an interpersonal guy. Like when I look toward my career in medicine and just going forward, I want to have an interpersonal element to it. So I agree. In dermatology, it's sort of like any outpatient clinic, like dentistry, dermatology. You're going to come in every year, every 6 months. So we see our patients pretty often, there are some patients who we see just about every 3 weeks, and we immediately know them when you see them in the lobby. You wave hi, ask how the family is. And so like that's been, as well, one of the most rewarding things to me. But it also, just generally almost kind of philosophically, I've always been drawn to medicine because of just how pure the intention is to help people.
Yes.
And that's kind of cliche, like everyone wants to help people. But I think, when you're making people healthier or like you're adding years onto their life, when we take out something that's cancerous and they get to walk out of the clinic cancer free, it's a really good feeling. Like it's so like serving the community of people that you've associated yourself with.
So obviously, and all the great things that come with this job, there's like any type of job, there's definitely the least favorite things, least favorite tasks, things such as that. What are some of your kind of least favorite things? Maybe specifically in dermatology, if you've what other field of medicine have you worked in, really, have you?
Yeah, I mean, fair enough. For me, at least, I had some internships with like research labs. This is actually my first job that was fully patient care.
Yeah.
And so I don't know any other like big medical career like workflows, but I do know sort of the hard parts about this job.
Yeah.
And so one of the things that is kind of nice about dermatology is like you never work nights, you never work weekends. But the flip side of that is you're always working 8 to 5, 9 to 5, and you rarely get any days off or any virtual days. Like I think I mentioned earlier, like dermatology and medicine in general sleeps for no one, like
100%.
if there are not going to be random like teacher workshop days like you have in schools where like the school board decides to have the day off. Like
we get our 40 hours.
We get our 40 hours.
Absolutely.
Yeah, exactly. And it's a tight margin. You are expected to be at work on time because patients start right away and they go right up to the end. And so I think I'm someone who likes a regimented schedule, and so that was good for me.
For sure.
But then, oh man, I feel like in a more superficial way for dermatology, something that I don't like, or something that I had to get used to, I guess, was there's some pretty like grotesque medical procedures we do. Like with the medical stuff, there's a lot of big skin cancer removals.
Yes.
There's cysts that don't smell great when you pop them.
Absolutely.
You're glad you're wearing a mask for that, right? But no, I mean, honestly, like with some of the big skin cancer surgeries, these are no joke. And so getting used to having people's like heads gashed wide open and you have to deal with bleeding and everything like that. Like that's something that was new to me. And I've again really kind of come to love having hands-on work like that, but it definitely like made you a little paler and weaker in the knees when you stepped into your first couple surgeries, right?
I couldn't agree more, man. But it's also like for me, here I am thinking, because I reacted pretty well to it immediately. I feel like, not to be biased or anything, but I kind of realize that's kind of my element, in the sense that I like stretching. I like holding pressure on bleeding. I like helping the PA put stitches in and stuff like that. Right. I don't mind the blood. That's, it's a weird thing to like, right? But here I know. So
someone's got to do it too.
Yeah, so whether that opens a pathway for me in emergency medicine or whatever it may be, here we go. But no, I couldn't agree more. I mean, it's some really crazy stuff that we see. Exactly. We got a lot of stuff in common. Me and you.
Yeah. Right? Oh yeah. No, it's true, because I'm that way too.
Right. But, absolutely. But not only many other things, but Brotox in general.
Brotox. It's so true.
We gotta tell the people about Brotox, right? Because there's very cosmetic procedures in general is very stigmatized. Where it's only with women. It really isn't. It really isn't. So who was it? Was it me or you that decided to get disc work first?
It might have been you, but then a minute later you told me, and I was like, I'm on board.
You're
on
do
board.
It.
Yeah,
I'll do it if you do it.
So
I'll do it if
pretty
you do
simultaneous.
it. Yeah, but I mean, talked about, where did you get disc work?
So I've gotten it in 2 areas now. My first area was in the glabella, and so Dysport is sort of like, we call it like diet Botox or Botox Light. It's like it's a botulotoxin. It helps relax muscles, and a lot of people use it to eliminate wrinkles. But you can also use it as a preventative measure for some medical issues and just aging in general. And so at first I got it in my glabella area, which is like in between the eyebrows. So if I scrunch, you can kind of see lines, but not as much as before. That's a very common area to get it because of kind of these creases. It can also cause headaches. But I've also gotten them in my masseter muscle, which I know you did. And you, like, debatably have worse TMJ than I do.
Yep. It was
with
a game
masseter Dysport, it helps relax this muscle right here, which then helps, first of all, slim your jawline. So there's a good cosmetic element to it. But then medically, that muscle can get really tight, causes you to clench in your sleep, which causes headaches. And since I've gotten Dysport there, it's really, really helped with the headaches.
Crazy,
but I think you have an even more experience.
It was
with
unbelievable.
That.
I mean, within weeks, I wasn't not waking up with headaches anymore.
Yeah,
right?
it's huge.
Not only do people think, right, it's not just cosmetic. A lot of these, maybe it is, maybe someone truly wants to, amp up their, physical,
which completely fair.
The physical complexion, whatever it may be. But for me, it was solely for a medical reason.
Yeah,
which is
right.
And don't stray away from the Brotox.
I
know.
It
is more men should do it. Honestly,
we're just trying to break down that stigma in a way. It's so kind of common and almost welcomed, I think, in the female community. And with men, it's just, I don't think there's as many men who are open about it or open to trying it too. And so it worked wonders for us. And so just kind of get the message out there that it can work well for guys too.
Right. No, absolutely, man. No, that's the people needed to hear that.
I know. I think so too.
You heard it here first. Going back to you. What's your plan here after Tureen Dermatology?
Yeah, so I'm pumped. I recently got the news that I have been accepted to medical school.
Yes, sir. Thank you very much. Yes, sir.
Thank you. Applause. So I'll be going to medical school in Kansas City, and that is going to start in the fall of 2024.
Absolutely.
And so yeah, I'm off to medical school, and I'm very, very pumped. After 2 gap years, it was more than a long time coming.
Yeah.
And so I'm pumped that all the hard work paid off.
Absolutely.
And I have a lot of hard work ahead of me too. It's exciting though. Any opportunity you get to further kind of along towards the goal of where you want to be is great. And working here has kind of even more given me confidence that I do want to work in medicine and be a doctor in the future. Following Dr. Tureen and our other wonderful doctors and PAs on staff, it just has even more given me given me confidence that I like working in medicine, and it's not that I just like science. I actually like medicine and working with people. And so I'm pumped to just try out a ton of different medical stuff. I love dermatology.
Yeah.
I would love to end up back in dermatology, but I'm also trying to keep an open mind, see what other branches of medicine I also might like.
Man. Absolutely.
Yeah.
What kind of because you're in, right? That whole phase of prepping for medical school and all that's behind you, but if you can revisit it just a couple more minutes here for those out there that are still going through the experience, still going through that rigorous application process, what are some of your kind of final pieces of advice for pre-med students preparing for the application, interviews, whatever it may be?
Well, one thing I really like to share is sometimes it's a longer process than you expect, but that's not necessarily a bad thing. Because I came out of college and I knew I was going to take 1 gap year. So I applied to medical schools. I applied to, I think it was 25 different schools, and didn't get in anywhere. And it was really hard. It was kind of devastating.
Right.
But, to hear all rejections is not what you want to hear. But that forced me to say, hey, I'm going to, do I really want to continue this? And the answer was, of course, yes. I'm going to stick with it. It's my dream. And so worked another year here, and it made my application even stronger. There's always the cliche of everything happens for a reason, but I truly believe that happened for a reason. I think I needed another year to sort of settle into myself, work another year, get another year with Shihab.
No, absolutely. I don't know what I would have done if you left.
I know.
I needed you, man.
I needed you. I know. So I would say, any advice is there are going to be bumps along the way, not even getting into medical school. But a stat I like to share is 60% of matriculants to medical school have applied more than once in more than 1 year. And so it's more than you think. It's multiple application cycles going through, it is a more common thing than you would expect. Happened to me. I got in the next year. And we're all good. So I used that year to really strengthen up my application, be a better person and a better applicant, and it worked. And so I think I like to be an example of, if you're really dedicated to the field and you're wanting to put in the time and you think it's worth it, just keep going for it. Like, you gotta keep chasing the dream if it is your dream, and the cards will all shuffle out in the right way.
Love it, man. Love it. Great advice, man.
Thank you.
That was incredible.
Thank you.
You should do a podcast, dude.
I know. I've always been wanting to. I was like, I should do this on the podcast sometime. Yeah.
Well, thank you so much for being here,
Yeah,
man.
of
No,
course.
this was awesome.
My
But,
pleasure.
yeah, absolutely. Well, my name is Shihab Adam, and this is the Daily Dose of Derm.